Today we will discuss what happens when a pet goes under anesthetic and needs to have his teeth scaled and polished, and how do we determine the need for extractions of teeth. This is a plastic version of a dog's mouth, and what we see here, we see the crowns. These are the crowns of the teeth, and we see the roots. These are the roots. And some teeth have only one root, like the canine tooth and this little guy here. Some teeth have two roots, like some premolars here, and some teeth will have three roots, like the big carnasal tooth here and the ones in the back. When we put the pet under anesthetic, we use this fine little probe to go around each tooth on the outside and the inside of the tooth, right at the gum level, and check for pockets. And that means that the probe should go under the gum line just a little bit, a few millimeters. It should not go under the gum line a lot, like this. If the probe goes under the gum line so deep, that tells me there is a problem with this tooth. And I will take dental radiographs or dental x-rays and look at the tip of the roots to check for abscesses or infections. If the dental radiographs indicate that I do have an abscess or infection, that particular tooth has to be surgically extracted. Antibiotics will not resolve the job, and it will just continue to create problems. The abscess will continue to create problems later on. Once the tooth is surgically extracted, meaning the roots have to be separated, the tooth has to be cut in half, and each root extracted individually, the gums will be sutured with resorbable sutures, and they will dissolve in time. When the pet comes back for the complimentary dental recheck in 2 weeks after the dental procedure, we assess how the gums look like, how the extraction site looks like, and we will indicate what is the healthcare plan that you can start to implement so that we prevent, hopefully, more problems later on. I hope this shed some light into how we determine the need for dental extractions in pets, and what happens when a pet goes under anesthetic, some of the things that we see and some of the things that we cannot see when we perform just a regular physical exam. Dental radiographs will help us a lot in determining the need for extractions.